Okay, can everybody please stand? Please be seated. Good afternoon. I would like to welcome all the first professional year or P1 pharmacy students, their families, significant others, esteemed guests, staff and faculty to the 2022 White Coat Ceremony for the class of 2026. I'm honored to be here today as we welcome the class of 2026 into the profession of pharmacy. I'm Sarah Browse, Regional Dean and Professor at the Texas Tech School of Pharmacy here in Abilene. And joining me on the stage are Dr. Molly Menz. She's the Associate Dean of Student Affairs and also Associate Professor in the Department of Pharmacy Practice. Our Dean, Dr. Grace Kuo, Dr. Chuck Seifert, Senior Executive Associate Dean, and Dr. Sanjay Srivastava, Professor and Department Chair for the Department of Immunotherapeutics and Biotechnology. This is an exciting time. Go ahead and be seated. This is an exciting yet challenging time to be entering the healthcare profession. Pharmacists are positioned as healthcare team members that can best educate patients about their medications, allowing patients to take a greater role in managing their disease states. During the pandemic over the past 2.5 years, we've seen a broader expansion of roles for pharmacists and also pharmacy technicians in immunizing patients and developing healthcare public health policy initiatives as we work to combat the pandemic. With the training that you'll receive, you'll be armed with the skills to enter this evolving healthcare system to be able to work with interprofessional teams of physicians, nurses, and other allied health professionals to be an integral team member in providing high quality, cost-effective care to the patients that you serve. In Abilene in particular, you'll have the opportunity to interact with our expanding class of nursing students. The nursing program is expanding this fall to a class size of 75 from the prior class of 50 to try to tackle the healthcare nursing shortage that has arisen from the pandemic. And our Master's in Public Health program, which launched in Abilene in 2016, has expanded over the summer to form the new Julia Jones Matthews School of Population and Public Health. So as pharmacy students, this new school will provide many new opportunities for collaboration, for projects and research, since pharmacy is a public health profession. The Texas Tech School of Pharmacy continues to evolve its curriculum to meet the demands that you'll face upon graduation. The class of 2026 will be the 5th class to experience our updated innovative curriculum that we've been carefully working on to prepare you for state-of-the-art pharmacy practice once you graduate. Today you'll hear from many faculty who will impart some words of wisdom upon you as first professional year students in our program as you enter the journey, and please take these to heart as you begin the new semester. And you remember that today you'll enter a noble and trusted profession with the donning of your white coat and by signing of the Professional Code of Ethics for Pharmacists. Now I'd like to welcome Dean Grace Kuo for a greeting.
Thank you, Dr. Browse. And good afternoon. On behalf of the entire faculty and staff of the Texas Tech University Health Sciences Center Jerry H. Hodge School of Pharmacy, we welcome you to the 27th Annual White Coat Ceremony. It is my great pleasure to introduce you and to welcome the class of 2026, your families and friends, the faculty and staff, alumni, and other supporters of the School of Pharmacy. I would like to thank many donors this year, including alumni and faculty who donated generously to help purchase the white coats. A special shout out goes to one of our alumni, Dr. Sean Hodges from the class of 2001. This year, he started an endowed fund to support the cost of white coat ceremonies across our 3 campuses. We have 4 campuses, but 3 of those campuses have white coat ceremony. And this ceremony today marks the 3rd of the 3 white coat ceremonies we have at the School of Pharmacy this year. Our school has amazing students. Just a few months ago, in May, we graduated 134 Doctor of Pharmacy graduates. 20 of them earned dual degree in PharmD and MBA. 31 of them went on to receive pharmacy residency training. And the majority of them, 115, decided to stay and serve in this great state of Texas. Today marks the day the class of 2026 enter the family of Texas Tech University Health Sciences Center. Our culture is value-based. There are 5 values that we uphold. When you walk around the school, and I welcome every one of you to come to the open house and the reception at the school after the ceremony, you will notice as you walk around the campus buildings, you will notice that these 5 values are either painted on the walls or hanging from the ceiling, or in some of the elevators, they're actually posted there as well. Well, these 5 values are: one team, kind-hearted, integrity, visionary, and go beyond service. Let me explain these 5 values. Number 1, one team. We unite and include diverse perspectives to achieve our mission. Our curriculum is team designed. Our courses are team taught. We expect our students to also learn in the team. Together, students, faculty, staff, we're one team within Texas Tech. Number 2, kind-hearted. We exceed expectations with a kind heart, helping hands, and a positive attitude. We don't want to educate our next generation of pharmacists to be very knowledgeable, but without that kind heart. Number 3, integrity. Be honorable and trustworthy, even when no one is looking, especially being a pharmacist. This is such an important value that we uphold. We share this among all healthcare professionals. Number 4, visionary. We nurture innovative ideas, bold explorations, and a pioneering spirit. Number 5, we go beyond service to create and deliver positive, defining moments. Class of 2026, as you enter into the family of Texas Tech University Health Sciences Center and joining the faculty and staff, together we want to strive to be one team, to be kind-hearted, to maintain integrity, to be visionary, and to go beyond service. The purpose of today's ceremony is to recognize the transformation of men and women of this entering class, from that of simply being a student into becoming a student pharmacist with the central obligations of professionalism and patient care. The white coat provides a symbol of healthcare, which encompasses the aspects of pharmacy practice as well as the delivery of pharmaceutical care. Today, you are making a strong commitment to work for the good of patients, to be compassionate, and to uphold our organizational values. And as we begin this ceremony, let me reiterate my congratulations, along with congratulations from the entire faculty and staff from all across the campuses, on your accomplishments in reaching this very significant milestone today.
like to introduce Dr. Trista Bailey, Associate Professor of Pharmacy Practice in the Geriatrics Division of the School of Pharmacy, to provide you with a vision of the future of pharmacy practice.
I'm just going to go with my own notes. All right, thank you, Dr. Browse, and thank you for coming to celebrate the future of pharmacy sitting before us. Picture this, 4 different medications inside just one pill. Insulin, a common injectable medication for diabetes, being used as a nasal spray to treat dementia. A tablet with a sensor inside it that can give information, such as when the pill was taken or when it dissolved in the stomach, and send that information to the patient or healthcare provider using an app. Now, some of you may be thinking that these scenarios sound like something out of the classic cartoon The Jetsons, but in fact, these are all advances coming soon to the profession of pharmacy. Right now is one of the most exciting times to be involved in pharmacy. The future of pharmacy is a bright and thrilling one. Pharmacists are training to be the healthcare professionals responsible for providing patient care that ensures optimal medication therapy outcomes. Essentially, the pharmacist will be the drug expert in every setting of the healthcare. In the community setting, this is seen in the expanding role of the pharmacist through a category of medications called behind-the-counter medications. Many pharmacists under a prescriptive authority are able to prescribe selected medications without the patient having to go to the physician and get a prescription. This category of medications includes hormonal contraceptives and most recently Paxlovid, an oral medication to treat COVID. The hospital setting is seeing pharmacists being utilized in more specialty areas such as emergency medicine and surgery. Pharmacists are vital members of the medical team that are looking for drug interactions, search for optimal treatment options, and even responsible for calculating the exact precise dose of a medication for a small 28-week-old premature infant. I could never do that. Way to go, colleagues. Many clinics in the ambulatory care setting are using pharmacists to act as mid-level providers, like a physician assistant or nurse practitioner. In fact, in the past legislative session in Texas, a bill was passed to create a collaborative practice agreement between pharmacists and physicians. Patients make an appointment with the clinic, just like the visit is run like a doctor's visit, with the pharmacist being able to write and adjust their own prescriptions under a practice independent from the physician writing the order. We are seeing the growth of pharmacists in specialty services. Imagine rounding with a medical team that specializes with anti-doping for professional or even Olympic athletes, because we had a student do that. We are seeing more pharmacists utilized in oncology, women's health, infectious disease, sports medicine, pediatrics, geriatrics, which is my specialty, and in a few short years, there will be more board-certified pharmacists in geriatrics than board-certified physicians in geriatrics, paving the way for pharmacists to make an impact on the silver tsunami known as the vast growth of the population of those 65 and older. So ideas that only started off as a thought or a dream are quickly becoming a reality. Health technology is another part of the bright future of pharmacy. Through advancements in technology, pharmacists are being able to discover ways to treat patients. Telepharmacy is an exciting opportunity that allows patients to be able to see and talk to clinical pharmacists via teleconferencing software like Skype or Zoom. This aspect of pharmacy has seen huge growth given the health crisis we experienced over the last couple of years. Being able to consult a healthcare professional while staying at home is one way a pharmacist can impact in healthcare. Personalized medication where your DNA is actually mapped out is becoming more available and cost-effective. Using your individualized genetic code, healthcare providers can test your genes to see if you'll be more susceptible to certain types of cancer, more likely to bleed with the use of anticoagulants, or even immune to HIV. Robotics are being used to treat patients with dementia, reducing the need for antipsychotics, which often can be harmful in older adults. Technology is changing the face of pharmacy and medication, and it will only be a short time before we ask, isn't there an app for that? So as you can see, the future of healthcare is exciting, intriguing, and coming soon. Welcome, class of 2026. You are the future of pharmacy. In conclusion, I will leave you with a quote from one of the biggest dreamers of the 20th century, Mr. Walt Disney. If you can dream it, you can do it.
And now I'd like to invite Dr. Brian Terrell, Up to the podium, he's an assistant professor in the ambulatory care division of the Pharmacy Practice Department in the School of Pharmacy to provide you with a history of Texas Tech University Health Sciences Center.
Thank you, Dr. Brous. Well, we just learned about where we're going, so let's talk a little bit about where we've been. So to fully understand the history of the School of Pharmacy, we have to begin with the history of the Texas Tech University Health Sciences Center. In 1969, the Texas Tech University School of Medicine was created by the Texas legislature as a multi-campus institution centered in Lubbock with regional campuses in Amarillo, El Paso, and the Permian Basin. In 1979, the charter was expanded to become the Texas Tech University Health Sciences Center. This charter led the way for the establishment of the schools of nursing and allied health, as well as the Graduate School of Biomedical Sciences. In 1993, the Texas legislature recognized the shortage of pharmacists in the 108 counties of West Texas and approved the charter for the School of Pharmacy, which was to be based in Amarillo. In order to establish the school, the city of Amarillo and numerous private and public organizations raised $13 million, enough to build a state-of-the-art campus, create many scholarship endowments, and support the school in its infancy. The Amarillo campus began accepting applicants and enrolled its first class in the fall of 1996. 1 year later, the school began accepting postdoctorates into the pharmacy residency program. Aside from training future pharmacists, the school also recognized the need to train individuals in biomedical and pharmaceutical sciences research. In 1999, the Office of Sciences added the Master of Science and Doctor of Philosophy in Pharmaceutical Sciences program. The Office of Sciences has grown over the years to include the Centers for Cancer Biology Research, Blood-Brain Barrier Research, Immunotherapeutics and Biotechnology Research, and the Clinical Pharmacology and Experimental Therapeutics program. In 2009, the school identified the need to provide select graduates interested in seeking leadership positions the opportunity to complete a combined PharmD and Masters of Business Administration degree. The first candidates for that dual degree program graduated in 2011. We are now also proud to offer a PharmD MPH dual degree tract. In addition to the ever-growing educational opportunities and research endeavors, the School of Pharmacy has expanded geographically to help meet the needs of the underserved counties of West Texas. In 1999, the school developed 2 regional campuses, which serve as 2-year campuses for our 3rd and 4th year students. The first is located in Lubbock, the home of Texas Tech, and is affiliated with its Health Sciences Center. And the second is in Dallas, which is affiliated with the North Texas Veterans Affairs Medical Center and UT Southwestern Medical Center. The Dallas campus has since become a 4-year campus. Our campus in Abilene began as a gleam in the eye of a number of community and private organizations in the city. This group included the Economic Development Corporation of Abilene, Hendrick Health System, Sears Methodist Retirement Centers, the Dodge Jones Foundation, the Diane Graves Owen Foundation, and the Shelton Family Foundation. This group approached TTUHSC in 2004 about Abilene hosting the next expansion of the School of Pharmacy. In January 2006, the Higher Education Coordinating Board approved the expansion of the school to Abilene for the PharmD and postgraduate pharmacy education programs. Thanks to the support of these groups and the community, a 40,000 square foot building was constructed, and the Abilene campus began accepting students in August of 2007. Abilene is also the site for the Immunotherapeutics and Biotechnology Research Center, a regional campus for the School of Nursing, as well as the home of the Julia H. Jones School of Population and Public Health. Today, the TTUHSC Jerry H. Hodge School of Pharmacy PharmD program includes campuses in 4 cities and accepts more than 100 Doctor of Pharmacy candidates each year, with many of those seats being located here in Abilene. Since the inaugural class in 1996, the school has conferred over 1,000 Doctor of Pharmacy degrees, and more than 300 pharmacists have completed the pharmacy residency program. Students, as you begin the semester, please remember all the hard work that has gone into developing and expanding the outstanding School of Pharmacy. And as you join us in the city of Abilene, please remember all of the generous social and financial support from this community. To close, I'd like to extend a warm welcome to the Health Sciences Center, to the School of Pharmacy, and to Abilene. Thank you.
Now I'd like to introduce Dr. Deborah Notorno-Strong, Associate Professor in the Pharmacy Practice Department, Practice Management Division, and she will discuss the symbolic meaning of the white coat ceremony and the signing of the Professional Pharmacy Code of Ethics that you'll take part in today.
Thank you, Dr. Brous. Let's see. Pick a tab. Yay! Okay, welcome everybody. So, today's white coat ceremony marks your journey, the beginning of your journey to enter into the profession of pharmacy. The history of the white coat was driven by the medical profession. The first formal white coat ceremony for pharmacists was held in 1995 at the University of Kentucky. Since then, the presentation of the white coat has become an important custom, if you will, that appropriates meaning to the white coat and serves as your guide as you cross the temporal and physical boundary from wherever you were before into the world of thinking and learning about the practice of pharmacy. This ceremony is not one of graduation or completion. It is one of initiation. It begins the development of a particular type of entity, that of a clinical pharmacy professional. As such, the white coat emerges as a symbol of professionalism, altruism, and humanism, and must remain an implicit reminder throughout pharmacy school. Some have said that students take on a new identity as one dons the white coat. When viewed in this light, this ceremony is a useful and important step in your professional development. Now let's be clear, there's nothing magical about your white coat, but it is much more than a garment. It alone sends a message that engenders trust in the competencies and the intentions of those who wear it. It stands for virtue and excellence. Your white coat represents your character, communication, caring, curiosity, and community. It is truly a cloak of compassion. Your white coat will serve as that outward symbol of professionalism that is expected during pharmacy school and as a pharmacist. As you step forward to accept your white coat, without a spoken word, you will accept the honor and privilege it represents and join a community of professionals who share the same values and ideals. Be proud, but remain humble. This is just the beginning and marks your transition. Upon receipt of your white coat, you'll be asked to sign the Pharmacist Code of Ethics. As healthcare professionals, it's important that we maintain the highest standards of honesty, integrity, and ethical behavior. The code states the principles that form the fundamental basis of the roles and responsibilities of pharmacists. These principles, based on moral obligations and virtues, are established to guide pharmacists in their relationship with patients, fellow healthcare professionals, and society. Student pharmacists are expected to acquire not only the knowledge and skills required to become experts in drug therapy, but the professional attitudes, values, and behaviors necessary to adhere to the code. By placing your signature on this document, you will willingly acknowledge and affirm your commitment to uphold the highest standards of conduct. The merit of this document relies heavily on the integrity of those signing it. Your signatures reveal that you believe in the inherent value of the document and the ideals discussed within it. So take a moment to reflect on what that means to you. And on those days when you wonder if it's all worth it, and we all have them, consider this moment and your commitment. This afternoon, with family and friends, you will pledge your commitment to our profession, to the health and welfare of your patients and the community that you will serve. Today is an exciting yet daunting time in your life. Here and now, you vow to become the best professional you can be and agree to be held accountable for your actions and your inactions. As your faculty and preceptors, we commit to model the behaviors and attitudes of being a professional and provide you with the wisdom and guidance to achieve your goals. The challenges ahead of you, class of 2026, are by no means small. but you are here because we had faith in you, in who you are, and in your abilities. It is my honor and pleasure to share this day with you, and I look forward to working with each of you in the coming years. Thank you.
Now it is time for the cloaking of the class. Dr. Molly Mins will call your name and tell a little bit about you as you proceed to the podium.
Could you please stand? Oh, sorry, only the students stand. I apologize. I should have given better instructions. Jonathan Chaco, Plano, Texas, the University of Texas at Dallas, bachelor degree in biology. Landon Cook, White Wright, Texas, Austin College, Bachelor of Science, Biology major, Chemistry minor. Cecily Elliott, Georgetown, Texas, Texas Tech University, biology major. Krishleen Fabian, Odessa, Texas, University of Texas of the Permian Basin, chemistry major. Daniel Flores, Monahans, Texas, Texas Tech University, Bachelor of Science in Biology. Jocelyn Friday, El Paso, Texas, University of Texas at El Paso, biology major. Danny Gill, Abilene, Texas, Texas Tech University, bachelor's in chemistry. Jake Hall, Perrin, Texas, Texas A&M University, biomedical science major. Bilal Karoum, Houston, Texas, San Antonio College, Associate of Science in Chemistry. Ashley Kelly, Odessa, Texas, University of Texas of the Permian Basin, pre-pharmacy major. Alexander Larkin, McKinney, Texas, Texas Tech University, Bachelor of Science in Biology. Connor Massenberg, Denison, Texas, Texas Tech University, Bachelor of Science in Biochemistry. Hannah Mays, Wichita Falls, Texas, Texas Tech University, Bachelor of Science in Mathematics. Jordan Miller, The Colony, Texas, Tarleton State University, Bachelor of Science in Chemistry. Maxwell Moore, Abilene, Texas, Abilene Christian University, biochemistry major. Tyler Mullen, Childress, Texas, Texas Tech University, Spanish major. Ife Otukuya, Laurel, Maryland, University of Maryland, College Park, Family Science and Human Development major. Nirav Patel, Odessa, Texas, University of Texas, Permian Basin, Bachelor of Science in Chemistry and Biology. Ryan Michael Patman, Odessa, Texas, University of Texas of the Permian Basin, Bachelor of Science in Chemistry. Michelle Shisabilo, Houston, Texas, Horton County Junior College, Fine Arts major. Andrea Stroll, Abilene, Texas, Hardin-Simmons University, Bachelor of Science in Biochemistry and Molecular Biology. And Richard Thiam, Odessa, Texas, Texas Tech University, Bachelor of Arts in Chemistry with a minor in Biology. Welcome, class of 2026. You may be seated.
I would like to invite Dean Grace Quo to the podium again to give the charge to the class of 2026.
Class of 2026, in a few minutes, you will be taking an oath to promise to do your best to care for others. This starts today as you begin your pharmacy career, not 4 years from now when you actually earn the title of Doctor of Pharmacy. And I'm sure starting from today, your families and friends will start asking you questions about medications and therapy. With the entire faculty and staff, and with our alumni, we want to instill in each of you a sense of pride in your chosen profession that affirms your commitment to the profession of pharmacy. Consider the magnitude of the promises that you are going to make with the oath. As Dean of the School of Pharmacy, I hereby charge you to become Texas Tech Raider Student Pharmacist. What do I mean by Raider Student Pharmacist? R-A-I-D-E-R. First, R, respectful. Respect your patients and put the interest of your patients before your own. To respect and value your fellow health professionals and coworkers to respect, support, and encourage your fellow classmates, your faculty, and your staff. A, advance. Pursue your education and training diligently from today until you retire from your career. Become lifelong learners to strive to be worthy of the privilege of being a doctor of pharmacy, a privilege that you should never abuse. I, innovative, inspirational, igniting your curiosity in learning. The Texas Tech Pharmacy program offers several unique programs. One, we offer more rotation hours than many other schools in the country. We are the only one of the few schools that require geriatrics, pediatrics, and rural health rotations. This gives you an opportunity to explore different areas of pharmacy practice. We have faculty members that practice in various innovative pharmacy practice settings, including the inpatient hospitals, including the ambulatory care, including the outpatient, including the community pharmacies, including managed care, including the industry, and several other innovative practice models and telepharmacy as well. We currently, as you know, we offer 2 dual degree programs, one in PharmD MBA program, the other we are starting in PharmD and MPH studies. PharmD MBA so far, we have graduated more than 150 PharmD MBAs from this program. This is the only program that I've known so far in the whole country that would offer you the opportunity to complete both degrees within 4 years' time without additional time and without too much of additional tuition. So take advantage if you're interested in any of these programs. And in fact, as we speak, we are also working on several concentrations and possibly certificate and other dual degree programs. This is the one unique program. I've been to other schools. No schools really have such state-of-the-art compounding labs such as ours. We not only have the compounding labs, the anatomage tables, the TechLink technology in one campus, but we have all of them in all campuses. This is a very unique program. I encourage you to take advantage of joining student organizations. There are about 22 student orgs here at Texas Tech. Networking is important. To please network with your fellow classmates to be a voice for the future profession in the local, the state, the regional, and the national, even international scene. You will have opportunities to explore honors and research by working with world-renowned scientists right here within our faculty, to engage in global health initiatives, interprofessional teamwork and collaborations with graduate students, medical students, nursing students, students of healthcare professionals, and also students of population and public health. To take advantage of studying with your classmates, to be active participants in the program. D, diversity, equity, and inclusion. To embrace and integrate diversity, equity, and inclusion into your pharmacy practice in your everyday work and working life. E, excellence and exemplary. To behave honorably throughout your career. To adhere to the student honor code and the rule of the university, as well as the rule of our profession. Lastly, R, reflective. To pause and to reflect upon what you have learned, both in school as well as in life, to take care of yourself, to maintain your well-being, and to be resilient. Class of 2026, you have our strong commitment of all the faculty and staff here to assure that over the next 4 years, you will develop into outstanding pharmacists with knowledge, skills, attitudes, and values necessary for you to exceed expectations of your patients and your communities. So congratulations, class of 2026. And at this time, I would like to ask all the faculty and staff to stand up and together with me to show you our strong commitment to make sure that you're successful in your career. And together, we welcome you to the family of Texas Tech University Health Sciences Research Center, Jerry H. Hodge School of Pharmacy. Welcome.
like to invite all the pharmacists in the audience to rise with the students and all the faculty that are pharmacists to take or renew your oath.
The oath of a pharmacist is very important and dear to all of us in the profession. And so students, I invite you to recite this with us as you enter as a student pharmacist. I also invite you to, in the future, reflect on the words whenever it gets hard, whenever you have a celebration with a patient, and whenever you're giving it your all. So if you would, raise your right hand and recite with me. I promise to devote myself to a lifetime of service to others through the profession of pharmacy. In fulfilling this vow, I will consider the welfare of humanity and relief of human suffering my primary concerns. I will promote inclusion, embrace diversity, and advocate for justice to advance health equity. I will apply my knowledge, experience, and skills to the best of my ability to assure optimal outcomes for my patients. I will respect and protect all personal and health information entrusted to me. I accept the responsibility to improve my professional knowledge, expertise, and self-awareness. I will hold myself and my colleagues to the highest principles of our profession's moral, ethical, and legal conduct. I will embrace and advocate changes that improve patient care. I will utilize my knowledge, skills, experiences, and values to prepare the next generation of pharmacists. I take these vows voluntarily with the full realization of the responsibility with which I am entrusted by the public. Congratulations, class of 2026, and welcome to the profession of pharmacy.
Please be seated. This concludes the white coat ceremony for the Abilene class of 2026. I would like to ask that everyone remain in your seats until after the recessional has passed. Immediately following the ceremony, we would like to invite all of you to attend a reception at the School of Pharmacy building at 1718 Pine Street, just a couple miles up the road. And there will be a few student organizations set up to provide more information about what they're about. And you'll have the opportunity to take a tour and see our beautiful facilities at the School of Pharmacy in Abilene, and grab some refreshments and just enjoy some fellowship before classes get started tomorrow. Immediately following the recessional, the class of 2026, if you could please meet the photographer out front and in front of the marquee, we would like to take a class picture for you all that we will proudly display in the hallways upstairs on the second floor of the School of Pharmacy, along with your signed code of ethics. And you can, when you take your tours, you can kind of see the prior classes displays as well. Class of 2026, please rise. And Dr. Klein and Dr. Lebec, if you could come to the stage to retrieve the bowl of Hygeia and also the banner to lead the recessional. I would also like to thank Dr. Pete Palmier, one of our class of 2019 alumni, for the beautiful music today. And we really appreciate you coming and playing beautiful music.